Hello everyone, I'm Morgan Lorenzo. I'm going to be talking to you guys about Hashimoto's thyroiditis today. The ratio of occurrence of Hashimoto's disease is 7 to 1 in the female population, and where it seems to be very common in females, it's also extremely rare in males. So you don't really find too many cases of this within the male population. Hashimoto's thyroiditis is actually the leading cause of hypothyroidism, and this type of thyroiditis is actually an autoimmune disease that completely attacks your thyroid gland, and it can also spread to many other body organs if it's untreated. This disease has many influencing factors which lead to its diagnosis, and the first one, there are 3 leading endogenous factors that, according to Lawson and Ledesma, are just the female gender in general, and pregnancy with the postpartum period as well as the fetal microchimerism. But in addition to the endogenous triggers, there are also very few environmental triggers as well, which include your iodine intake, which also later in my speech I will talk to you guys about goiters, and your iodine intake actually has a huge role in sometimes developing a goiter if this is left untreated. And a few other things that will be environmental triggers would be drugs or infections, chemicals, anything like that. And lastly, the other thing that plays a huge role in this disease would be genetic factors. So there's a list of genes which you may have, or may have a combination of the gene, which would increase your likeliness to actually develop this disease sometime in your life. And all of these factors essentially lead to increased antigen presentation, so it eventually causes your thyroid to be destructed. You also might be asking yourself how one notices the illnesses or symptoms of Hashimoto's disease, which brings me to my next slide. Some of the common symptoms, which actually it may take many years for a patient to even develop or notice any type of these symptoms. The most common symptoms are weight gain, fatigue, the goiters I just mentioned previously, and a cold intolerance. And for those of you who do not know what a goiter is, it is actually the enlargement or the swelling of the thyroid gland, and your thyroid gland is actually located in your neck. Once a patient starts experiencing these types of symptoms, normally you'll be under the care of a physician, and if you have any type of thyroid issue or any type of like a hormone producing gland, you would be referred to see an endocrinologist from your primary care. However, in order to diagnose this disorder, you will have to go through some testing. The first thing that they pretty much do just right off the bat would be a blood test, just like your everyday other disease that they would test for, or even sicknesses. They automatically test your blood. You know, we can determine a lot of stuff from our blood. And the other thing that they could possibly do would be an ultrasound of your thyroid gland to make sure there's no, tumors or any type of enlargement that is unusual. When you're looking at your blood test for this particular disease, they're actually looking for the presence of the thyroid autoantibodies, which would in turn reflect that you have this disease. And once this disease is detected, your doctor may offer you a series of treatments that are available. However, even though there are a few, today the primary The primary treatment that would be given to a patient with this, which would probably be a mild case or even a case where there's no tumor, would be thyroid hormone replacement therapy. So basically, this type of therapy includes giving a patient a synthetic form of T4, which is the hormone that you lack with this autoimmune disease. And from a personal experience, I also have this disease, and I got this when I was pregnant. I will finish telling you guys about that. But the medicine that I use is the Voxigrin, and there's also the other common one is named Synthrin. But on the other hand, for a more natural source of treatment, which a lot of people are tending to do these days, would be a change in your diet. Also, according to Dolan, which is somebody I researched, it has been proven that this nutritional approach can be successful in managing this disease, which you would just avoid sensitive foods such as gluten and soy, and also take vitamins. Vitamin B, vitamin D3, omega-3 oil, and even probiotics help with this. While thyroiditis is an autoimmune disease, well, this type of thyroiditis is an autoimmune disease, I would actually consider it to be maybe one of the more mild ones. And lastly, I'd like to leave you guys with my journey that I've went through with this process. And I actually was diagnosed with Hashimoto's after I had my son, and I was lucky enough to be able to have just the treatment of the thyroid replacement therapy. Thank you all for listening to my speech, and I hope I educated you all on a disease that's actually out there and very common in females that means a lot to me that not too many people know about. Thank you.